I'm Oh Soo-young at the Arirang News Centre. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. In just a few moments now, we're going to cut into the briefing at the Sejong Government Complex with simultaneous interpretation available in English. We're going to go right now into the briefing room where Kim Gang-lip, overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates on the COVID-19 situation in Korea. So we're just about to do that now, and soon we're going to see a room with a podium where Kim Gang-lip will be making his way to give us the updates on the latest figures of the virus outbreak and the infection cases, and it looks like the briefing's just about to begin.
Let us now begin our regular briefing for April 16th, Thursday. As of today midnight, we have a total of 2,627 people who are in quarantine, and 7,757 have been discharged following full recovery. 229 people have died. And yesterday was the general election day for South Korea, and we had 22 new cases, and 141 more people were discharged following full recovery. Unfortunately, we had 4 additional fatalities. I send my deepest condolences to those who have passed away. Of the 22 confirmed cases, 11 were reported domestically here in Korea, and a total of 11 were reported as imported cases. And among them, 4 have been reported at the airport quarantine, and 7 have been reported in the community. And 11 of them all were Korean nationals. And Prime Minister Chung Se-kyun convened a KCDC meeting this morning, during which touched upon the issues, including the campaign for supporting and encouraging the medical practitioners. And Prime Minister Chung Se-kyun has said that after the global pandemic of the COVID-19, the Korea's general election was the first national election that was carried out. And he also thanked the public for showing a very high level of solidarity, understanding, and civil awareness. And today we begin the second phase of the online classes, and he said that the number of the students are actually 4 times that of those from the last week. And he also said that the measures for the timing for the reopening of the schools physically will be considered in a very careful approach, taking the example of Singapore. And today we reported that 22 people have been newly confirmed, and this was about the same as the overall average of this week. And after the 22nd of March, we participated in enhanced social distancing campaign, and we believe that this is the outcome of such campaigning. And we also like to extend our deepest gratitude to all of the public for participating in our social distancing campaign. However, taking the considering the time lag between the identification of the confirmed cases, we believe that this is the outcome of the first round of the social distancing campaign. We cannot let our guards down as of yet just by looking at the numbers, and we cannot ease our social distancing campaign as of yet. And we continue to ask you to refrain from making physical contacts and gather public gatherings. And we also believe that this is an important measure to protect yourself, your families, and your neighbors. Yesterday, we had the parliamentary election, and many of the national citizens and the public have went to the polling stations. And looking at the high voter turnout rate, we were originally concerned about the easing of the social distancing campaign. However, we would like to thank you for your participation. At the polling stations, you stood in 1 meter distance from each other. You washed your hands with hand sanitizers, and they were witnessed across the country at polling stations. And also, among these self-quarantined, about 81%, which is about 10,000 more people have actually casted their votes under the guidelines of the quarantine authorities. They walked on their foot or they took their own cars and they were casting their votes in separate routes from the other citizens. And among the global pandemic of the coronavirus, many countries are delaying their national elections. However, we were able to carry out our own national election thanks to the participation of the public as well as the efforts put forth by the civil officers of the local municipalities as well as the National Election Watchdog. And we believe that this was another very positive example, making us an exemplary country in the international community. And as we have intensified screening of the inbound travelers starting from April 1st, we saw a decline on the number of foreigners who are coming to Korea, and we also have heightened measures for screening for the foreigners. And we believe this was possible thanks to the effective use of our human national resources here in the country. And we believe that this also helped us to further curb the influx of imported cases. And with the heightened control on the borders and screening, we believe that this is for the sake of the country's safety, and we ask for your support and understanding. Today at the KCDC meeting, we talked about the campaign to encourage the medical practitioners. The government is committed to support the medical practitioners who are fighting on the front lines. And starting from today, we will have a voluntary campaign involving the public. And thanks for these medical frontline healthcare workers, we were able to overcome the coronavirus outbreak. And we have named this as an help out campaign for the medical practitioners. And we also would like to mention that this is open to any of the public, and they can participate in this campaign by uploading on their SNS. This is the image of the campaign badge that we are currently designing, and we hope you can utilize these hashtags in your social network accounts. And for the public and the healthcare workers who participate in the campaign, these badges will be given out. And even as we speak at this very moment, there are many medical practitioners who are working at the front line, and I would like to thank them once again. And also many of the public, I ask them to come up with creative ideas to participate in the campaign to encourage our medical practitioners. The government is also in implementing the enhanced social distancing campaign. However, we are trying to carry out a transition into a sustainable everyday life quarantine measures. As we mentioned earlier, from on top of the first round of such meeting, we will be meeting with the experts of diverse different circles, and we will have a second round of meeting for this committee. And the Everyday Life Quarantine Committee will also talk about the necessity in terms of medical aspects for these measures. And we would also like to come up with practical and sustainable measures that can be carried out by our public. Together with the schedule of the enhanced social distancing campaign, we will be rolling out in-depth discussions on how we should curb the virus going forward. This means that we need to cooperate continuously going forward against the prolonged outbreak of the COVID-19. However, we would like to say that the transition to the everyday life quarantine is only possible when we have a lower level of community transmission. So we would like to ask you to participate in our social distancing campaign going forward. And if you have any inquiries, and we would also like to provide and reflect them, so we are accumulating public opinion. And starting from the 12th of April until the 28th of April, that is, we will carry out an online survey. And as of now, we have about 5,100 people who have participated in raising their opinions, and they have raised a diverse range of opinions. And we would continue to accumulate these opinions through our webpage, KCDC webpage, as well as our SNS accounts. And these will be very much reflected in the everyday life quarantine measures to be rolled out in the future. We are having warmer temperatures, and I know that many of you are planning to have outings. However, we believe that this is a necessary time to practice a social distancing campaign. And we would like to ask you to refrain from having indoor closed meetings, and especially we are still seeing cluster infections in the metropolitan area. So we also want to ask those people who are living there to be extra cautious. Despite the enhanced social distancing campaign period, many of the confirmed cases in the Yecheon-gun of the Gyeongbuk County province we have witnessed that they have moved, and they have visited many locations, including restaurants and multi-use facilities. And we have seen a large surge of the confirmed cases. And we know that what the outcome will be if we ease our campaign. And just one person can infect up to 30 people. And we want to also curb the further spread of the community transmission in other areas as well. Based on our know-how accumulated so far, we believe that we know that we are closely interconnected with the rest of the public, and we know that abiding by these measures are very crucial, and it's a responsibility to make a safer country. Just as you did so far, I hope that you continue to participate in this campaign and cooperate with our efforts to curb the virus going forward, and we can successfully overcome the outbreak. Thank you very much.
That was a live briefing from the South Korean health authorities that you just heard. We just heard that there were 22 additional infection cases, bringing the total number of infection cases here in the country to 10,613. Unfortunately, there were 4 more deaths, bringing the total death toll to 229. Well, this concludes our coverage of this morning's briefing. We will be back in just a short while at 12 p.m. Korea time with our regular midday news. Bye for now.